important that it's extremely important that we know that cardiovascular diseases have risk factors. And we've mentioned some of the modifiable risk factors. Another modifiable risk factor is, taking fizzy drinks. All right. So fizzy drinks, is a cardiovascular risk factor. Okay, modifiable. All right. Then, stress, environmental pollution, and all the rest. We looked at that 2 weeks ago, so I'm not going to really, go so much into that. And the recording is available on the platform. You can get it. All right. And then we have, non-modifiable risk factor, age. As one ages, the chances of having cardiovascular disease increases. Gender, males are more at risk until the females attain menopause. Genetic predisposition is also a risk factor, and the rest. All right. Having said that, we also went into some symptoms, clinical features of cardiovascular disease. Dyspnea on exertion. Okay, dyspnea on exertion, which is getting breathless on exertion. Very, very important for us to know. Okay, leg swelling, fatigue, easy fatigability, and all of that. You will see all of that. You can pick up the first meeting. The recording is available, and we'll repost it after this time out. Now, today, what we want to consider is prevention. Prevention is key. And it is important for us to take note of this because, if we can prevent cardiovascular disease, honestly, it's going to be a very, very major achievement for us all as a society. All right, very, very important. Cardiovascular disease, by the way, is the leading cause of death globally. And it is the leading cause of death in Nigeria as well. It is not malaria. It is the leading cause of death in Nigeria. Stroke, heart failure, kidney disease. These are leading causes of death, okay, in Nigeria, and we need to be aware of that. So prevention is key. So prevention of cardiovascular disease ideally starts during pregnancy, and it is lifelong. And may I even say it starts before pregnancy. Why do I say that? Now, the mother of the to be child, the mother of the intending, a child, okay, that is coming to the world, must go into pregnancy with optimal health. If there's malnutrition, if she smokes, if she has diabetes or any illness at all, may make her not to really go through the pregnancy without storm, it can affect the baby. Remember, we said that there are landmarks of cardiovascular health. The first landmark that we talked about is in the phase of organogenesis. That's the phase of development of the organs in the body. The heart is the first organ to start working in the body, all right, and it is the last organ to sign out. However, it is important that we know that things can go wrong while the baby is developing. And if things go wrong, the baby can have what we call hole in the heart, congenital heart defect. So even during pregnancy, the optimal health of the mother is important. All right? Very, very important. Low birth weight is a risk factor for cardiovascular disease. And then big babies is a risk factor for cardiovascular disease as well. So you can see that it's important. What goes on during pregnancy is also very important. So cardiovascular disease prevention starts even before the child comes, into the world. All right. Having said that, there are, actually 4 major prevention levels. I'm going to start with the primary, because a lot of people fall into this aspect. So primary prevention targets at those at risk of developing a first cardiovascular event. These are people who are hypertensive, people who are diabetic, people who have increased cholesterol, those who smoke, and all the rest. All right. They are at risk of developing a cardiovascular disease, coming down with stroke, coming down with, heart attack and all the rest. And we want that prevented. All right, so that's primary prevention. Secondary prevention are targeted towards those who have established cardiovascular disease. They've had, one event or the other. They've had a stroke. We don't want them to have a second. They've had, maybe heart attack. We don't want them to have a second. They've had a heart failure. We don't want them to progress and become worse. All right. And of course, tertiary prevention also. We don't want them to, to keep going and, get to end stage phase. All right. But very, very important amongst all of this is the primordial prevention. Primordial prevention are measures put in place to prevent development of risk factors. So somebody who is not hypertensive, we don't want the person to develop hypertension. So, healthy lifestyle is very important. Somebody who is diabetic, we don't want him or her to develop diabetes. Okay, very, very important. Primordial prevention will do that. And how does that come about? Lifestyle changes, lifestyle modification, very, very important. All throughout the phases of prevention, whichever phase you are in, it is important for us to know that lifestyle is extremely important. All right, lifestyle modification is very key in preventing cardiovascular disease. All right, so it is important also for us to know that cardiovascular disease, all right, are largely preventable. 80% of causes of cardiovascular disease are preventable by cultivating healthy behavior. Very important. 80%. Now, if 80% is, of causes are preventable, then it means that we can actually keep this thing at bay. But it is very, very it's worrying that despite the fact that 80% of causes of cardiovascular disease are preventable, many people come down with it every day. I just told us that cardiovascular disease is the leading cause of death in our world, is the leading cause of death in Nigeria and globally. And we need to do something about it. We need to cut it down so that we don't continue in this phase, in this trajectory. And I'm sure that as we, take our health, more seriously, it will help us to be able to, deal with cardiovascular illnesses, cardiovascular risk factors, and all the rest. Very, very important. So prevention of cardiovascular disease, I will look at it from two ends. Number one, personalized or individualized targets. And then the second is population or institutionalized targets. All right. So lifestyle modification is key in this. Let's go through the personalized target first. So smoking cessation. Somebody who smokes should be advised to quit smoking as much as possible. Reduction of salt intake is very, very important. And sometimes people ask for soda water or ask for other things. Or let me give me soda water. I don't want Coke. Soda water is salt in water. All right. So if you have hypertensive, if you have heart failure, you have symptoms of difficulty in breathing and the rest, please, it will do you good if you can, quit, taking it or reduce the intake as much as possible. Reduce the intake of fat and cholesterol-rich meal. Very important as well. Reduce consumption of processed meats. All right, red meat. Very important that we reduce it. Red meat is a risk factor for cardiovascular disease. Why? They are rich in cholesterol, and that can predispose to cardiovascular disease. So, including their skin, the eyes, shaki, more roundabout, our body, seaweed, and all those stuff. We need to cut them down. Yes, they are the sweet things, but the sweet things most times are the things that that gets people to trouble. So we need to cut them down. Exercise regularly. Regular exercise is also very, very important. Preventing cardiovascular disease. Increase fruit intake. Very important. All right, all grains and nuts. These are important things that we should take. Take more fruits, take more vegetables, take more, nuts and all grains. They are healthy for us. Limit intake of sweet things, of sugar sweetened beverages. All right, Coke, Pepsi. Sorry, I'm mentioning the trade names. You know them, the sodas. Reduce their intake because they have cardiovascular risk factor tendency. Instead, take healthy, beverages. Cocoa drink, for example, is healthy. All right, healthy drinks. All right, green tea is healthy. Okay, even black tea is healthy. Greek yogurt is healthy. Fruits, you can blend fruits, make them into smoothies and the rest. These are healthy, stuffs that we can have. Okay, so very important that we go in that direction so that we can be able to lead a healthy life. Dark chocolate is also good for our health. Please, if you can hear me, can you just type yes for me, please? Somebody wrote that he or she can't hear. If you can hear me, please type yes. Please, if you can hear me, type yes. Okay, thank you very much. Thank you very much. So we can continue. So dark chocolate is good for the heart. All right. Not, and the dark chocolates are those that usually will not have all the creamy stuff, all the sugar, and all the rest. They are the ones that will, they're quite, to an extent, they are even bitter. All right, but they are very, very. Then aim for a healthy weight. All right, a healthy weight is very, very important. What that means is if you're obese, you need to cut down on your weight. Weight reduction, scheme and exercise and the rest should be put in place. Aim for a healthy weight. Very important. Take a break when necessary. All right, we need to take a break when necessary. Okay, it's not all work, work, work. All right, deal with negative emotions. All right. And in the issue of take a break when necessary, it's also important to stress that, we should give time for adequate rest, adequate sleep. Okay. Let's, time for deal with negative emotions. And okay, sorry. Can you hear me now? Please, if you can hear me, kindly type yes. I think network had issues. Please, can you hear me now? Kindly help me type yes. If you can hear me, kindly type yes. All right. Can you still see my screen? Can you still see my screen? Okay, okay, thank you very much. All right. So we were talking about stress management and dealing um with mental health issues. Okay. Very, very important. Very, very important that we take that to cognizance. Uh, okay, just a minute. Come back now. Okay, can we if you can see it, kindly type yes for me, please. Can you see my screen now? Okay, thank you very much. All right. So stress management is very, very important. The next one, cultivate positive emotions. Okay, be cheerful and make room for humor. Extremely important. We've got to, deliberately cultivate positive emotions. Deliberately, more deliberately be cheerful. Deliberately do things or that can cheer you up because it is good for your mental health. It is good for your cardiovascular health. Reduce or stop altogether alcohol, energy drink intake, and all fizzy drink, as much as possible, things that will not help you. And then reduce exposure to pollutants as much as possible. Generator fumes, fumes from exhaust of cars, and so many pollutions that we considered some of them last week. All right, very, very important that we reduce exposure to pollutants as much as possible. Then we've got to know our numbers. Know your numbers, please. We've got to know our numbers. Check your blood pressure, check your pulse rate, check your blood sugar, check your cholesterol level regularly. It's important. All right. When we do, it will help us to be able to, know the state of our health. Some people get diagnosed of hypertension for the first time when they come down with stroke. That shouldn't be. I said I've never gone to the hospital, I've never checked it, and then is this person right? I mean, on the bed in the emergency, rushed down by maybe neighbors or friends or family members. Sorry, hey, he cannot move his hand and his leg, one part, and all those. And by the time you check, the blood pressure is 200 over 120, and the person has never checked it before. That's not proper. That's not proper at all. We've got to take more responsibility for our health. And if you are hypertensive or diabetic, check these things regularly. It won't cost us much. So that if the numbers are going up, you can quickly reach out to people, to physicians, to doctors who can help you. So know your numbers. All right. Now, these are the the levels of prevention that I mentioned. Primordial prevention: quit smoking, increase physical activity, quit sedentary lifestyle, unhealthy weight must be dealt with, unhealthy diet must be dealt with. At this point, the level of primordial prevention is actually more often than not the level of lifestyle changes, the level of taking full responsibility for your health, making healthy choices and the rest. Very, very important. Efforts taken to minimize the development of cardiovascular risk factors. The person who is not hypertensive should not become hypertensive. As much as possible, do things that will drive, that will pull you further away from becoming hypertensive. If you have a family history of diabetes and you're not diabetic, you shouldn't be. You can prevent it by embarking on very, very responsible, healthy life style, and life choices that will pull you away from developing hypertension or developing diabetes. Okay, so the fact that you have parents who are hypertensive does not mean the offspring should be. They are more at risk, but it doesn't mean that they should become hypertensive or diabetic. That this is the level we're talking about, primordial. And when the if the person now has a risk factor, obese, high blood pressure, diabetes, increased cholesterol, we need to deal with it by, you know, intensifying healthy lifestyle choices, and also, medications may need to come in at this point. I mean, you go to the doctor to get your hypertension controlled, your blood pressure controlled. You go to the doctor to get your blood sugar controlled, and to make sure that complications don't come. And then the secondary and tertiary ones, to make sure that, a first stroke does not lead to a second, a first heart attack, or heart failure, or kidney fail. I mean, kidney disease does not lead to a second. All right. So keep your clinic visit regularly. It's part of prevention. You are hypertensive, you are taking your drugs, you know, you have a regular clinic, keep it. Don't say that they're just going to say continue management. The doctor will check things that you cannot check. Last Friday, I saw a patient, okay, who, they gave a drug and she just went away. By the time she came back, she had developed diabetes. And then I asked her, I said, how did this happen? She went to another clinic though, but eventually she was now referred to our own clinic. She because her blood pressure was also not well controlled anymore. So they had to refer her, to the cardiologist. What happened? They gave her a drug. She doesn't know the name of the drug, and she went away. And when they asked her, why didn't you come back? We've been looking for you. We've been trying to, get you. Why didn't you come back? He said, oh, you always write to me, continue my management. And they told her that drug, are you still taking it? She said, yes. They said it was just meant for, just for a time, just 1 month or thereabout. And this woman went for more than 6 months. By the time she came back, she was fully diabetic. By the time I was seeing her on Friday, she already had complications, of heart disease. All right. So it's important we keep our clinic visit regularly. It's important we take our drugs regularly. It is important you avoid self-medication as much as possible. People say, oh, my neighbor gave me this drug. No, you can't take the drug that your neighbor gave you. Cross-check. Okay, can you hear me now? Sorry, we had a bit of. If you can hear me, please type yes. Apologies, please. A call tried coming in and disrupted everything. Okay, thank you very much. All right, so we're talking about the institutionalized um targets. Okay, these are targets, you know, taken as a collective body by the government, by association, and things like that, just to cut down cardiovascular disease. All right. So targets such as policies targeted towards lowering salt content of food and other products in the society. All right. Policies targeted towards reducing intake of saturated fats, and the rest. Policies targeted towards, reducing tobacco consumption or ultimately eliminating it. Education and enlightenment, elimination and reduction of environmental pollution as much as possible. And then social reforms are also very important. All right, building of recreational grounds, where people can exercise, where people can have, generalized to a very good extent. And we should promote, such things in our society. National Day, we used to have environmental sanitation. And I argue, I say that we need to also start having, exercises that can, National Day to promote exercise, for example, walk for life day, for example, cycling day, for example, and things like that. In an organization, the organization can decide that on Fridays, from 8 a.m. to 9 a.m., those that can come early join us and things like that. A gymnasium, or it's you know dedicated to those who may want to exercise and things like that. Those are institutionalized things that can maintain healthy lifestyle. I'm going to stop here for now for today. I hope it was worth the while. Thanks for listening. God bless. So I'll questions. We can type our questions on the chat box. You can raise your electronic hand so that the host, if it's possible, I think the host every will be in the question and answer time. Thank you. Can we unmute Mr. Babs, Akin Johnson and Monisola, so that they can ask their questions? I think the host is not there now. Okay, I think the primary host is not there. I'm seeing one, Damilola. Please, I think Damilola is the host now from what I'm seeing. Can you help unmute these people, please? If you know how to do that. Or, to save time, if we can type our questions on the chat, in the chat box. I guess maybe network problem with the primary host. Please, if you can type your question while we're trying to sort out the audio. And Mrs. Monisola as well, if you can help us type your question while we try to sort out the audio challenge.
Hello, can you hear me?
Yeah, who is this? Hi.
Can you can I go ahead? Hello.
Time is not what we used to write things.
Hello, can somebody hear me?
This
Thank you.
meeting is
So
being
you can hear
recorded.
me. Thank you for speaking.
Okay.
And I'll
Okay.
attempt to, I
You
want
can ask your
to,
question.
good evening to everyone. Good evening, Dr. Lucia. Good evening. Thank you for having us today. So I'll attempt the first question. I'm being asked to speak. So there's a question, difference between heart failure and heart attack. Yes, there is. Why heart failure? Heart attack is a general way
Then
for people to understand,
I'm
and a
listening to
situation in which there is a blockage in blood vessel supplying blood to the heart, and then due to things like chest pain, and then the person will have severe pain that require the person to hold the chest, and then uh, and can actually progress very fast to lead to other things that can even lead to death. So heart attack is the general way in medicine. For us cardiologists, we'll be
This
talking
meeting
of ischemic.
is being recorded.
For us, we're talking of things like acute coronary syndrome, myocardial infarction. So that's the. But heart failure refers to the ability of the heart to pump blood to meet the requirements of all parts of your body. So what that means is heart attack itself can actually lead to heart failure. Heart failure can result from so many reasons. It can be there's a problem with the structure of your heart. It can be like somebody had a heart attack. It can be that it may be even a functional problem in the system that the heart cannot cope with. It will now lead the heart to fail, and so it's unable to supply blood to meet all the all the needs of the body. And so, of course, the person can present with things like breathing difficulty, inability to move very far. It gets tired easily. The whole body might start, the legs might start swelling up. The person might start coughing. But generally, when you talk about heart attack, it's usually from blockage of a significant blood vessel that makes that can lead to heart failure or lead to the heart being able to also perform its duty. The treatments are different, and of course, both of them can actually lead to sudden death if not well managed. I hope that answers the question. Thank you.
Yes, answer it. Can you unmute him? Hello. Thank you, Dr. Okogun, for
This
that.
meeting is being recorded.
I don't know whether you finished addressing what um the question, but really thank you for that. Um, Heart failure and heart attack, there are differences, and that's just the difference, really. Heart attack, major blockage in a vessel, all right, that leads to dysfunction of the heart. It can also cause death, outright death. Okay, and the risk factors are there for everyone to see: hypertension, diabetes, increased cholesterol, salt intake, obesity, and the rest. All the things we've discussed about are things that can cause that can lead to heart attack, and heart failure has also been dealt with. Yes, any other question? You can raise your electronic hand. If the host can unmute everybody, I think that will be fine. So that so if you have any other question, you can ask. You can unmute yourself now on your own. So Dr. Okogun, if you still want to say anything, I think you can. Dr. Doye, Dr. Obieli, and the rest. Sir, Pa Akin Johnson, do you still have any question? Your hand is still raised. Any other question, you can raise your electronic hand and ask.
Dr. Joseph, can you hear me? Hello?
Yes, I can.
Okay, please.
Yes, I can,
How
sir.
much exercise should one do? I mean, that is tolerable, that is allowed.
Okay. All right, Dr. Odoye or Dr. Obieli, do you want to help us with that? How much exercise should one?
Okay, thank you, sir. My name is Dr. Donye. So before you engage in exercise, it's also important to be certain of the state of your heart, okay? And to be sure there are no symptoms that suggest that you have a heart condition like heart failure, as was explained, or heart attack, as it was explained earlier on. It's also important that you know your numbers, your blood pressure before you start exercising. And when we're sure all of those things are fine, or even if there are such conditions that you are under medication, then you can go ahead to do your exercise. So basically, the exercise shouldn't be about doing weightlifting as it were, or doing something very stressful. Just brisk walking, about 30 minutes, let's say every week, or let's say 5 to 6 times in a week is all right. So you don't necessarily have to do something very strenuous, as it were, maybe going to the gym to lift something, carry weight and the rest of them like that. So just regular frequent exercise as such like that can hardly help the heart. So I wouldn't know if this will suffice or you still want more clarification. Thank you.
Yeah, well, I think that's okay. Thanks a lot. I've seen cases. I saw a case of somebody. Hello, can you hear me?
I'm with you, sir.
Yes, you can.
There was a case of when I was in the military, when I was in Navy, I was serving at Calabar. There was a case that then in the evening, 2 people went to play squash. We were just still trying to warm up. One of them just dropped, and that was it. It's not as if he has not exerted himself. He just dropped like that.
Okay, sir. So for that also, there are causes, there are things we call sudden cardiac death, and there are a number of causes usually. So for those engaging in military activities or sports, footballers and the rest of them, it's very important they undergo basic screening before you actually start doing intensive exercise, as it were, like that. Your ECG, your echo, there are a number of conditions. Medically, we call some of them hypertrophic cardiomyopathy, arrhythmogenic right ventricular. I don't want to bother you with, but there are a number of things that makes people susceptible to having sudden cardiac death. And for those who have had people who have died in the family, they are not sick, as it were, they just died just like that. Then you need to be a bit more careful before you go into exercise and make sure you are thoroughly examined before you actually engage in such a venture.
So thanks a lot. I'm grateful.
Welcome, yes, sir.
Sorry, can I ask, was there autopsy carried out on that patient, on that person?
Well, I don't know because I was in the Navy. He was in the Army. And
Okay.
then, yeah.
Oh, okay. Because it's very likely, just like what Dr. Doya said, it's very likely that that person has an underlying thing. And it could even have happened. It just happened on the golf, court or something. Okay, it could have happened anywhere. There are people that then maybe in an executive meeting and suddenly slops. All right, there are people who sleep and are not able to wake up. That's why we say as much as possible, please take care of your health, know your numbers, deal with things that need to be dealt with. It would have been nice. I think if the person was in the military, they would have done the autopsy, but because you're not in the same,
not in the same, yes, different.
yeah, maybe you didn't know, you couldn't follow up on that. Thank you very much, sir.
All right.
Another
Thanks a lot.
question. Okay, there's a question on the chat. You're welcome, sir. There's a question in the chat box. When are the drugs being prescribed by the cardiologist for heart and other related sorry, I can't see it. Okay. And other related issues going to be done with or is it going to be for life? The cost of these prescriptions keeps skyrocketing. Dr. Bieli, are you there?
Hello, sir. So I'm already
Bieli?
replied on. Good evening, sir. I already replied.
Okay, yeah.
I replied most of those messages.
Okay.
Yes, sir.
Okay. Do you want to?
Via the chat.
Yeah, but for the purpose of those who are not their chats.
Okay, sir. So the person is worried about the medication that is first asking if the medication for high blood pressure is for life. So the medication for high blood pressure is for life, as you have to take the medication to keep your blood pressure under control. Again, we understand the fact that medications are skyrocketing. However, there are several options, and your doctor will always prescribe a cheaper, effective version of the drug for you. So my advice is to go back to your doctors, tell them that maybe the particular brand you're taking is expensive, and then he can always prescribe a similar effective version that is cheaper for you. Thank you very much.
Okay, thank you very much. So you will need to look out for cheaper drugs. If you meet with your doctor, I'm sure that he or she should be able to give you alternatives. Yes, so many things are going up now, but our health still very, very important. Okay, I am 52 years. My diastolic is always high, and I usually feel sensation or a kind of dragging on my right neck. I guess you want to ask, what should you do? Dr. Okogun, do you want to take that, please? Increase diastolic blood pressure. Okay, if Dr. Kongo is having difficulty in connecting back, let me just say that yes, if you have increased diastolic blood pressure and you're 52, it just simply means that your drug requirement is more than what you are taking now. You need to get back to your doctor. He or she needs to assess you and maybe increase the dose of what you're taking now, or bring in another drug that can help you to control your blood pressure. It's extremely important. The blood pressures must be controlled for us to have a very healthy lifestyle. And of course, you can also always reach out to the cardiologist, and then they will, be able to help you correct control your blood pressure better. My first time with coffee last year resulted in higher BP, 133/87 or so. It came back to normal after a month range. after I stopped coffee. I took coffee again a week ago and my fingers started shaking. Stopped after a day. What could be wrong? Well, I think you are reacting to caffeine in the coffee, and I think you need to stop it. Just look for other um, healthy drinks or healthy beverages to take. We mentioned cocoa drink. A lot of people, uh, quite a sizable number of people react, or to coffee really. All right, yeah, it's so definite that you are reacting to caffeine, and coffee is not for you. So please, I think I will advise that you stop it. Does taking Exforge HCT affect or increase the number of time you visit the toilet at night? And is 1 or 2 times okay depending on the water intake at night? Dr. Odoye or Dr. Billy, do you want to help us with this?
Good evening, sir. I've also answered this, and the person has actually replied. So, also the person
Okay.
is taking a combination of Exforge HCT. So the hydrochlorothiazide is a diuretic. So diuretics are medications that make you urinate more. So the fact that the person is urinating more may be due to the diuretic that the person is taking. And also it depends on the time the person takes it. So if the person takes the drug at night, so that might be causing the increased diuresis at night. However, also when you lie down, there's an increased blood flow to the kidneys. And when there is increased blood flow to the kidneys also tend to make more urine. So you get up more and then go and urinate. Again, there are some people that have some certain conditions that you tend to have more of urination at night. So like example, like diabetes, or if you have a urinary tract infection, so you can also have that. So, but however, you may need to get to if the increased urination at night becomes bothersome, you may need to get to your practitioner for further evaluation. Thank you very much.
Thank you very much, Dr. Odoye. Dr. Billy. Thank you so much. All right. I think I don't know whether my first time. I think we've taken that one, the coffee one. When is the best time to take clopidogrel? Anytime that is okay for you. Clopidogrel is not a time-specific drug. You can take it at any time that is okay for you. All right. So if there's any, I think we've addressed everything. If you have any other question that we have not addressed, you can either put in the chat box or you raise your electronic hand or mute yourself and ask your question. Any other question or clarification? Okay, if there's none, I guess we've had a good time. Thanks for your patience. I think network today was a bit challenging.
Sorry, sir. Hello, sir.
Going up and down. Yes,
Hello,
please.
sir. Please, sir, there's someone
Please
that
go
is
ahead.
saying
Please
that
go
we
ahead.
haven't addressed his or her question. I think Mr. Ido,
Okay.
he's saying that we haven't addressed his
Okay.
question. His question is, please, for some weeks now, I started having pain on my feet, especially the heels, and find it difficult to walk when I stand up from bed or chair. So his question is, what possibly could be the problem? So I think he's probably having or peripheral neuropathy, means that the nerves are malfunctioning. So you probably need to meet your doctor and have a discussion with your doctor, so that your doctor can advise you on what to do for that, because there are medications for that. Thank you.
Okay, thank you, Dr. Billy. Yes, that's sounding more like a peripheral neuropathy symptom. The nerves around your legs, supplying your legs, are becoming a bit dysfunctional. Sometimes they cause peppery pain. Sometimes the patients will describe it as if ant is walking all over their legs. Sometimes it's shock-like and all the rest. All right, and quite a number of things can predispose to it. So we don't know your history. If you are diabetic, diabetics are very much prone to this. You may need to get in touch with your physician, okay, to to deal with the diabetes. If you are not diabetic and you have not checked your blood sugar for a while, or you have not done your routine medicals for a while, I think it's high time you actually did that. Okay, you need to do your medicals. It may just be that one thing or the other is needs attention. Okay. So diabetics are prone to it, those who are obese are prone to it, those who have increased cholesterol, and then with reduced um, of blood supply to the limbs are also prone to this. And of course, so many things can predispose to this. So you need to see your doctor, and if you don't have any, you may want to contact us. We will deal with it for you. It's something that we need to know what is causing it, and then we also treat you for it. I hope that answers your question and your concern. Any other question or concern before we round up?
Before we round up, please, I have a question.
Sir. All right, sir.
Yes. What could have been the cause? I feel numbness on the last two fingers of my hand, my right hand, and my thumb, just at the tip. I feel numbness.
Dr. Dai, you want to help? You feel numbness. All right. What about your toes?
Okay, sir.
No, there's no numbness in my toes.
Okay, sir.
All right. Thank you, sir.
My fingers, the two last fingers and the thumb.
Okay, sir. If I may answer your question, sir. If I may answer your question, are you with me, sir? Hello. Can I go ahead?
Yes, please do. Sir, please, can you, I think two of your devices are on. That's why we are having this echo. Can you put off one? Maybe the Adekunle or Nofora, you can put it off completely so that the echoes will cease.
Okay. I'll put it on.
Disable the audio. Okay, Dr. Don't go ahead.
Okay, so I think you need to actually see of what is exactly causing that, because from what you said, I think it's limited to the hand alone. I'm not sure whether it's the right or the left. So a number of things can run through our mind. Like it was earlier said, that diabetes could be a cause on one side. But apart from that, we also have what we call cervical spondylosis. It's possible to have pain around the neck, and the pain radiates down to the arm, and the digits around that area will tend to have this numbness you talked about. Or there could be some form of injury to the nerves. I think the ulnar nerve or thereabout on that side. So you need to be well examined to be sure of which of all of these options is actually playing out, so that the right drug can actually be given, and also necessary investigations done. I hope I was able to do justice to your question, sir. Hello.
Thank you very much. I think that's what we need. Yeah, thank you, Dr. Noy. I think
Yes,
you have answered it very excellently. You may need to it may just be coming from the neck. Cervical spondylosis is a major cause of, upper limb numbness and the rest. All right, especially if it's limited to the upper limbs. Okay. It's not sounding like a carpal tunnel syndrome, but we don't know your history. That can also, if there's a local compression of a nerve around that area, that can also cause it. All right, but it's something that can be dealt with. So you can see your physician, sir. I'm sure that the person can be able to investigate further and then treat it for you. Thank you, sir. Any other question or comments before we continue? Okay, thank you. If there's no other, I hope we got value for our time. And we wish every one of us good health. If it was worth the while, you can just type something on the chat box, got value, or nice presentation, nice interactive session. Just drop something on the chat box. Let's see whether we were able to address our concerns. If you got value, you can type got value. Okay, thank you very much. Thank you very much, Mark. You got value. Thank you very much. Thank you very much, my friend. Thank you very much, sir. All right, thank you very much. Thanks, everyone. Thanks for your patience. Even when, thank you very much, Mark. Even when network, thank you very much. Thank you very much. Our next, thank you very much, Mark. Our next, all right, thank you very much. So our next edition will be in 2 weeks' time. I think that will be, let me just quickly run through. That should be on the 18th of, yeah, of February. You can reach out to others. You can, I think the last time we came, the first time it was more than this. We were more than 90. I guess maybe network, affected some people from coming in for this one. So, but I'm sure that the next one will even be more than that. Okay, thank you very much. Sir, do you have a question? I can see your hand up, your electronic hand. Do you have a question or comment, sir, before we call it a day? Sir, Mr. Pa Ake Johnson. Okay, I think it's maybe raised in error. All right, thank you very much, everyone. Enjoy the rest of your day and have a very good week and a very lovely, productive month. Thank you very much. Bye for now. Thank you.
Thanks, Doctor. Bye.
Thank you.